the next thing that I'm going to transition to, which is something that is also sort of concerning, is COVID, right? We're having this conversation about what's going on abroad, but here at home, COVID, especially in Washington, COVID is top of mind. On Tuesday, the office of Vice President Kamala Harris announced that she had tested positive for COVID. Later that day, in an interview with PBS NewsHour, Dr. Anthony Fauci, the chief medical advisor to the president, raised eyebrows when he said this.
We are certainly right now in this country out of the pandemic phase.
But he soon clarified his comment in an interview with NPR.
Is the pandemic still here? Absolutely. We are now transitioning, not there yet, but transitioning to more of an endemicity where the level of infection is low enough that people are starting to learn how to live with the virus.
This comes as President Biden is facing pressure from Republicans and Democrats over his plan to lift a Trump-era immigration policy. Citing health concerns during the pandemic, Title 42 has forced migrants seeking asylum to remain in Mexico. And now the Department of Homeland Security is focusing on how to handle the influx of migrants that will come to the U.S. if the policy is lifted. Of course, this is all making its way through the courts, we should add. But I'll go to you, Nicole. How concerned are Democrats about this COVID funding?
Well, I think there's probably the biggest concern among the administration right now because they have been signaling and sending warning alarms over this for weeks now since this initial package was put forth before the Congress. And I think it's important to remember that it was significantly bigger, based on what was ultimately negotiated in the Senate. The price tag has now come down to about $10 billion. And so, again, this is to kind of help aid in if the pandemic worsens again, to aid in future pandemics. And so that's why the White House says that this funding is needed. But we saw right before the recess that this got bogged down over this disagreement over Title 42, with some Republicans wanting to attach a provision to this kind of COVID funding package, basically preventing the administration from being able to lift it. And so because of the disagreements there, they weren't able to move that COVID funding forward. So now, once again, you see the administration trying to urge Congress to push this through. That's why, as we discussed earlier, there's this possibility of trying to move it with the Ukraine funding because they know they probably will have more support for that. But again, if there is not that support for the COVID funding, or if other things like immigration, Title 42 get tied to it again, this is something that could be a long slog.
And Michael, I want to ask you about Title 42, but before I do that, I want to focus on COVID for another beat. To just explain how the White House is really explaining and justifying asking Congress for all this COVID funding, while, of course, Dr. Anthony Fauci is saying the acute phase of the pandemic is possibly behind us.
Yeah, so they're definitely trying to walk a careful line on the messaging front in terms of balancing things that don't necessarily go together. I think their main message and their main fear on COVID is down the line several months. They don't want to get to a place where there's another surge, or there is a good development in a new vaccine that's developed, let's say, this fall, but because there's not the money, the United States government goes to the company, maybe Moderna, maybe Pfizer, and says, hey, we'd like to buy 500 million doses of this. And the company says, well, that's great, except we're all sold out because other countries have already ordered their batches. And so, it is for a future, they are trying to sell it as for a future development, but it's not a future like, some, years down the road, something else may come about. They feel very strongly that there's a strong possibility they're going to need that money in the next several months to continue to fight the virus. And I think they recognize who is going to be blamed if they ultimately don't have the money and are sort of held back in their response to the virus.
And Michael, I want to stick with you for a moment. The vice president, of course, was diagnosed with COVID, we learned this week. And President Biden is making the decision to still go to the White House Correspondents' Dinner. It's going to be a dinner with at least 2,000 people there. The president and the White House are saying that the president is going to take a lot of precautions. But what's the thinking of sending him to that dinner? And is there any concern at all about the chain of command?
So, in terms of the latter question, the chain of command, they've expressed lots of confidence that whatever happens, even if he were to get COVID, that that it would be mild because he's been vaccinated and boosted, and that he would be able to continue to perform his duties, or other people, obviously, if he were sick enough, the vice president could step in. I think, though, that they are really struggling to find the right place to be where, to find that sort of compromise where they, reflect the attitude, the growing attitude of most Americans, which is that we're sick of this pandemic and we're ready to move on, while at the same time, not throwing overboard completely all of the restrictions that they've been arguing for so many months are not only essential but recommended. And so they're trying to find that sweet spot, and I think they're really struggling, as frankly a lot of us are, who have sort of taken off masks in certain environments but are putting masks on in other places. The White House said that he would go to the dinner, to the correspondence dinner, and he'll be there for the entertainment and the speeches and the like, but then he's not going to actually eat dinner there. He's going to leave to try to minimize the amount of time that he's there. So it's a real tough balancing act, and I think they are struggling to find where that right place is.
It's a tough balancing act.